The latest numbers show that New York State continues to beat the odds when it comes to COVID-19, while other states are still reeling from this second wave of infection. 88,000 people were tested for the virus yesterday here in New York. That is the most ever done in one day. Less than 1% were positive. There were 10 COVID-related deaths statewide yesterday, and hospitalizations are now at a record low. Since the pandemic began, 424,000 New Yorkers have become infected. 25,000 of them have died. And now there is a concern about young people who at first seemed almost immune to the coronavirus. But in these troubled times, what happens when children become ill and there's not enough money to pay for the treatment, whether it's COVID or something else? Here's 7 Eyewitness News reporter Ella Araby.
It's just really important to me that kids stay happy and they get treated well, and if they're diagnosed with something, that just shouldn't get in their way. They should just stand up strong.
8-year-old Jack Marchetta and his family are one of many who are advocating for increased financial support to adequately fund children's health care. The family is meeting virtually with members of Congress in hopes of making it happen. Jack has a rare and incurable autoimmune disease called juvenile myositis. It causes his immune system to attack his own cells and tissue, resulting in debilitating muscle weakness and skin rashes.
He was on chemotherapy for 3.5 years, and we had to give him a weekly shot. At a certain point, he was on 11 different medications, and now he's on a monthly IV.
Jack gets medical care at Oshai Children's Hospital, home to his angels on earth.
The nurses, they're almost the best thing that could have ever happened to me. They're super nice.
The Marchettas are advocating for more federal funding because they recognize the care Jackson receives from the team of pediatric specialists at Oshai. But because of the pandemic, pediatric hospitals have been particularly hit hard. Many hospitals canceled elective procedures.
Children's hospitals right now across the country are losing $67 million a day, over $2 billion a month. And as the pandemic continues on, these losses are just not sustainable.
Another problem, cuts to programs like Medicaid. Oshai Chief Medical Officer Dr. Stephen Turkovich says more than 40% of Medicaid recipients are children. Medicaid provides health coverage to 1 in 3 children nationwide.
Medicaid has got a lot of targets on its back because it's usually a very large program for state budgets. And so when you look at trying to cut a state budget, you look at the things that are the largest. But people don't think about children being one of the primary people on Medicaid.
They're innocent. These are innocent kids who've been dealt a hand that is not fair. And I think that it's our job as a society to step in and help. So I think that's really funding that should never be questioned.
In Buffalo, I'm Ella Araby, 7 Eyewitness News.